Welcome everyone to our podcast here on World Cancer Day. We appreciate those of you who are joining us, and we're excited to be able to spend the next 30 to 45 minutes with you talking about issues that are really important for people with cancer. And I'd like for you to stay tuned because one of my guests has an ask for you at the end and specific ways that you can become very active in World Cancer Day and helping to preserve access to people who have cancer. My name is Linda Bohannon, and I am the CEO of the Cancer Support Community. And I'm going to be joined today I am joined already by two guests and people who are really important to me. I'm lucky to work with them every single day. Elizabeth Franklin, who is the president of the Cancer Support Community, and Felicia Woods, who is the executive director of the Cancer Policy Institute here at the Cancer Support Community. So they are poised and ready to answer my questions and your questions and share a little bit about the work that we do here at the Cancer Support Community. I wanted to first take just a moment to tell you who we are and what we do. And I realize that some of you found us through our Facebook page or through our website or a number of different ways. So many of you are familiar with us already, but there may be some of you who aren't familiar with our organization. So we are a large network of about 175 locations around the world who provide care and service to people with cancer. So we do support groups and one-on-one counseling, and we do education, we do social activities in those centers. And we really are at the core a service delivery arm. Our whole mission is to ensure that no one faces cancer alone and that there's someone with you on your journey. The organization, however, also does research. So for those of you who are interested in participating in research and really elevating your voice around what it is like to have cancer or to be a caregiver of someone with cancer, we do research as well, and we do public policy. So the idea is that we learn a lot from the people who are boots on the ground in our affiliates. And I call patients and caregivers walking through doors in a normal non-COVID world, or walking through our virtual doors as we are on websites and on telephones these days during COVID. But we learn a lot from those individuals. We also learn a lot from the research and the people who elevate their voice through the research that we do. And really what that does is it allows us at the Cancer Support Community to take all of those learnings and share what patients and caregivers are telling us about having cancer with people who are making really important decisions about your care. So whether that be someone at the National Cancer Institute who is designing a clinical trial, or someone at the FDA as they're thinking about making a decision about a drug approval, or someone who sits on Capitol Hill as they're writing the next generation of 21st century cures. Might even be somebody at your insurance company when they're thinking about what their decisions are going to be made around what they're going to pay for and what they aren't going to be paid for. So I just want to sort of anchor us in that piece. We're a 40-year-old organization. We deliver about $50 million in free services to patients and caregivers each year. And we touch about 1 million patients in some way, whether it's through our telephone helpline or whether it is through those affiliates that I had mentioned to you. So service delivery first and foremost. It's important for you to be engaged in a way, again, that Felicia will talk to you about during this time together, and allow us to do what we're going to talk about today, which is how we elevate those learnings to people who are making important decisions about your care. So with that, I would like to formally introduce my guests. I'd like for you just to tell our viewers a little bit about yourself. So Elizabeth Franklin, I'm going to start with you and ask you to just give an overview of who you are and why you're here and what you're most proud of.
Sure. Thanks, Linda. And hi, everybody. Happy World Cancer Day. I feel like this is our Super Bowl, so it's more important than the Super Bowl that's coming up. Super excited to join you on Facebook Live today. As Linda said, my name is Elizabeth Franklin. I'm president of the Cancer Support Community, and I have spent my career in oncology. I am a social worker by training, and I've been with CSC for about 4 years now. So super proud of the mission that we have, which is to serve all people impacted by cancer. So patients, survivors, caregivers. And that truly means all of us at some point. So, I just want to start out today by saying that we know that today we're talking about policy, as Linda said, and cancer is inherently a policy activity, but it's not a political activity, right? It doesn't matter if you identify as a Republican, a Democrat, or an independent. Cancer policy matters in a variety of ways, and we need everybody's support today to ensure that patients can access and afford the treatments and resources and services that they need. So I just want to reiterate that it's incredibly important to us. We are nonpartisan. We are here to support people impacted by cancer. But that's also to say cancer policy is extremely important. It is what makes sure that, as Linda said, the NCI has funding, the FDA has funding, that patients can access and afford their treatment. And that's why we do this work every day, to make sure that people impacted by cancer have access to the medical services, the psychosocial services, the resources that they need. And so we're going to talk today a lot about what it means to be a cancer advocate and why it's so important. And it means a variety of things. It's engaging in social media to make your voice heard. You heard Linda say it's simply sharing your story. Our researchers want to hear from cancer patients because that informs our policy work. It's literally anything you do, talking to your insurance company, elevating your voice in your own institution and your hospital, making sure that what's important to you carries on and is implemented in policy and decision making. So we know that cancer is complex. It requires funding, it requires attention, it requires advocacy. And that's why we're doing this today. And I'm super excited for Felicia to tell us more about her background and how we can get engaged directly with the Biden-Harris administration, with Congress, and ways that we can elevate our voices. So Felicia, I will turn it over to you to introduce yourself.
Sure. Thank you, Elizabeth, and thank you, Linda. As they all said, my name is Felicia Woods. I am the Executive Director of the Cancer Policy Institute at the Cancer Support Community. And so at the Cancer Policy Institute, our main focus is to elevate and amplify the collective voice for the cancer community, and to really make sure that that voice is heard on Capitol Hill and the administration, and also throughout state and local communities. And just by way of background, I have worked on Capitol Hill for a number of years. I worked for Senator McCaskill and also former Representative Carnahan from Missouri. So I understand the importance of advocacy, understanding the importance of grassroots action and how that affects change, and how it helps to move the needle when it comes to working and engaging with policymakers. And just to go a little bit into what we need to be doing as an organization, but also as a collective community, to ensure that the new administration, Congress, and the Department of Health and Human Services promotes access to affordable and comprehensive care. One, we need to ensure that they are prioritizing people with chronic illnesses such as cancer. We as CSC value elevating and amplifying the collective cancer community voice with policymakers. As the nation's leaders, they are enacting policies that will affect all of our patient populations. And kind of similar to what Elizabeth said, cancer patients, we're also looking at loved ones, survivors, everyone in that journey with all of us. So CSC has urged Congress, both the past and current administration, to enact policies that would put patients first. And in particular, I would like to go through some of the policy actions that we've already been engaged in, and that's increasing access and affordability of healthcare. We want all individuals to have access to no or low cost services and ways to reduce, prevent, diagnose, and manage cancer and other chronic illnesses. People impacted by cancer must be able to afford and maintain their health insurance coverage, as well as be able to pay for their prescription medicines and therapies, because that's important. So having that full range of essential health benefits without any restrictions or discriminations related to pre-existing conditions is so important. And another policy that we are actively engaged in is strengthening Medicaid, and looking at how Medicaid has played such a central role in providing affordable healthcare coverage for cancer patients who may have low incomes, but a way to strengthen Medicaid is ensuring that there's Medicaid expansion in states that have not expanded right now. And especially given the COVID-19 context, we need to ensure that states are doing the best that they can to provide coverage for vulnerable patient populations. And another thing that I really want to highlight is reducing health disparities in cancer care. It's one important thing that we at CSC are actively doing in this space, and that relates to disparities in care. We know from prevention on to screening, on into survivorship, disparities exist. So CSC strongly supports efforts to eliminate health inequities. And we're asking Congress, along with our other partner organizations, as well as the administration, to really look at ways to eliminate health inequities, because individuals impacted by cancer should not be discriminated against based on their health status, their age, gender, ability level, race, ethnicity, sexual orientation, gender identity, or any other characteristic. So our federal government, our state and local entities, as well as us, have to do our best to ensure confidence that we are taking the right approaches to eliminate these disparities in care. And last, I would say funding for research and engaging and making sure we encourage routine cancer screening. CSC understands the importance of research. As Linda pointed out, we have our own research and training institute where we're dedicated to really keeping the patient at the center of the conversation. And we know that discovering new ways to detect, diagnose, and treat cancer is important. So making sure that there's funding at the National Institutes of Health and the National Cancer Institute is instrumental to getting those new treatment therapies available for all, and making sure that we are working with our community to encourage routine cancer screening, because early detection and screening leads to lower mortality rates, and we know that prevention works. So those are just a few things that we need to be doing to prioritize cancer patients.
Great, thank you, Felicia. There are several, and I am taking notes, so that's what I keep looking around for. I wanted to repeat those, right? So for the people who are listening, and I know that you're gonna, in the favor that you're gonna ask them at the end of this, they'll be able to see all of these in writing, but I just want to sort of highlight them. And I know that we have listeners who have already submitted questions, and a number of the questions are addressed in some of these, so I do want to explore them a little bit more. And I'm going to ask you for some clarification, right, in terms. So one of the first things that you talked about, you used the words access and affordability. Mm-hmm. And so either you, Felicia, or Elizabeth, explain the difference between access and affordability for people who might just sort of think, as I did for many years, I've got my insurance and it's covered, no problem. What's the difference between those two?
So I'll start and ask Elizabeth to chime in. Access is being able to get the care that you need, having healthcare insurance, being able to go into the doctor to get that specific care. Whereas affordability is the ability to be able to pay for their services. So, and have the resources there dedicated to you. So you need the access, and then you also need to be able to afford it. And there's policy procedures that will increase access, but if a patient can't afford or be able to pay, making it the decision between, paying for their prescription drug versus paying for their rent or paying for food, that puts them between a rock and a hard place. And as a patient, we want them to be able to have all three, not have to make that critical decision. And so I think those are the distinctions, but I will allow Elizabeth to add on as well.
Yeah, 100%, Felicia. There is no access without affordability, right? They go hand in hand. And so just because you have access to something, if you can't afford it, it doesn't matter. And we saw that before the Affordable Care Act was signed into law, right? We saw that there were no caps on what cancer patients and other folks with pre-existing conditions had to pay. So let's say you can get cancer treatment, but it's $1 million. I don't know many people who can pay that out of pocket. So unless you have policies to ensure affordability, then access really doesn't matter. And that's why policies like the Affordable Care Act are in play. Felicia talked a lot about Medicaid, which helps to provide healthcare and insurance coverage for our lowest income neighbors and friends. And it's there to make sure that we can afford it. Because again, hand in hand, you can't have one without the other.
And I'm going to flip that, and then I'm going to come to you, Elizabeth, on the question around essential health benefits. But I'm going to flip it and talk about where you might be able to afford something, but it's not available to you. You don't have access to it. And I'll use the example of a clinical trial. So maybe because of the new laws and regulations that are in place, your health insurance would cover you to participate in a clinical trial, but you may not live in an area where that trial is available to you, right? And I only want to point that out because we're having this conversation about, from the White House essentially to the living room, and ask the experts about, why we're doing these things. But that's an example where the conversations that we have about access are important, and making sure that there are a number of clinical trial sites available, that there's individual use, protocols in place, those sort of things. So I just want to make sure that we covered both of those areas. So Elizabeth, one of the areas that Felicia talked about was the essential health benefits. And I know, because I worked with you for a number of years, that you took a lead role in helping to form and establish the conversation around essential health benefits and some of the tools that are available to people as they think about this new enrollment period. Can you just talk a little bit about what are the essential health benefits and why do our listeners care about them?
Absolutely. And it is exactly what it sounds like. Those health benefits that are truly essential to making sure that when you have access, you are able to access and afford things that really matter to you. So those are things like prescription drugs, being able to go to the emergency room, certain cancer screenings. We heard Felicia talk about the importance of cancer screenings. These are all things that we need in order to stay healthy, to treat cancer, to catch cancer, super important things. And through the Affordable Care Act, these things are available for free to people who have coverage. And so when you think about, cancer screenings, or, we think as women, right? Like we have our well woman visit or our well person visit, you don't have cost sharing with that. Because of the ACA, you have those essential health benefits, because ultimately we know that things like prevention works, early intervention works, and we're able to save more money in the long run. And so that's why essential health benefits were created. And the cancer support community actually led the way to help cancer patients or people who are at risk for cancer to think about what they might need when they're selecting a healthcare plan. So it's called the Cancer Insurance Checklist, and it's at cancerinsurancechecklist.org. And it provides a range of questions for you to think about. So whether you are a stage 4 breast cancer survivor today, or whether you have a family history of colorectal cancer and you've yet to be diagnosed, if you may or may not be diagnosed, it's questions to think about when you're selecting healthcare coverage. So if you are on the exchange, which is the website or websites where you can select the health insurance coverage that fits your needs, you can actually go through that checklist and decide what's most important for you. But those essential health benefits are one key piece of the overall benefits provided by insurance coverage. So cancerinsurancechecklist.org is a great place to start, so you can think about those essential health benefits and all of the other things that you need from your insurance coverage.
Great. And we're going to come back to that because we have some questions that I think fit squarely into this essential health benefit situation. Felicia, the energy in your body when you talked about Medicaid expansion, I thought you were going to come through your computer screen. So talk to us about what is Medicaid expansion. What are you talking about when you say Medicaid expansion, and some states have and some states haven't? And again, why do our listeners care about that?
Well, it goes back to some of the information that Elizabeth just shared, in ensuring that our folks and neighbors who have low income have access to a full range of coverage. And Medicaid provides that full range of coverage for them. In a number of states, I believe 38 states in the US have expanded Medicaid through the Affordable Care Act, it allowed them to expand Medicaid to ensure some of our lower income, more vulnerable populations have access to care, access to affordable health care. And 12 of our states have not expanded. And we know from research that the Medicaid expansion really helps to address disparities in care. There are a number of vulnerable populations that depend on Medicaid to help them get coverage that they need, especially cancer patients, to ensure that they're getting the screenings that they need, getting the treatments that they need, having access and being able to afford prescription drugs. And without this expansion, especially right now in the COVID-19 context, where so many people are losing jobs and employer-based healthcare, Medicaid expansion could help fill in the gap for those cancer patients who may have lost their jobs, or even for their loved ones that fit within the income range to be able to have access to affordable care. And so us advocating for it and making sure that states are working to protect their patients is definitely something that we have to continue the drumbeat on Capitol Hill and even with our state governments.
And we issue, and at some point in time, we'll also talk to people about joining our grassroots network, but we issue times when people in those states who haven't expanded can actually send messages to their lawmakers to help advance that particular cause. So Miss Elizabeth, research funding. When we're talking about research funding, what are we talking about? Who does the money go to? What do they use the money for? What are we asking for?
Yeah, it's a great question, Linda. And it is, research funding is the building block by which all cancer treatments, and I'm going to say not just medical, but also the psychosocial piece as well, right? Because that's what the cancer support community is here for, to make sure that we're meeting all of the needs of cancer patients. So think about institutions. Felicia mentioned the U.S. Department of Health and Human Services, and underneath HHS are institutions like the National Cancer Institute, right? And so there are researchers in the National Cancer Institute who are leading the way in terms of cancer research, coming up with innovative new treatments. We're investing over the last 2 to 3 decades, more money than ever in cancer research. And you can see that because you see the treatments taking off, the innovation taking off. It's no longer just chemotherapy. Linda, you and I talk about this a lot because you, as an oncology nurse, remember the days when the only options were surgery and incredibly toxic chemotherapy. That was it. Those aren't the only options anymore for some patients. So we still have chemotherapy and surgery, but we also have things like targeted therapy, immunotherapy, CAR T cell therapy. So we're re-engineering the human body to fight our own cancer cells, right? It's extraordinary. It's almost like science fiction. And that's because we have invested in research in the National Cancer Institute, in a variety of different institutions across health and human services, to make sure that we are recruiting the best and the brightest, and we're able to commit resources to them so that they can do this kind of research that ultimately becomes the cures. And, even though it's outside of cancer, you saw an example of that this year with the COVID-19 vaccine. We had the basic building blocks in place to create the vaccine, and that's why we could do it so fast, because we've been building up to this moment. So research funding is incredibly, incredibly important, whether it's at HHS, NCI, also funding for the FDA to make sure that we can approve treatments and therapies. And then, like I said before, mental health as well. So we think about the variety of different agencies that support psychosocial researchers, which from our perspective is equally as important.
Thank you for that. It's very helpful. Felicia, healthcare disparities, or disparities in healthcare. What I loved about your description was your description went deep into, it's more than just the differences in the way that we look, but it also goes into the way that we think, the communities in which we live, right? So I'd love for you to talk a little bit more around healthcare disparities and either some of the work that we're doing or some of the work that we're asking the new administration to tackle.
Sure, I'm happy to. And I would have to say, just being a Black woman, I know the importance of making sure that we address health disparities. My own personal journey or interaction with in the oncology space, I came in armed with a lot of information when I first talked to my oncologist about what I saw when it came to the specific cancer that I was facing. And, you know, he came in and was able to address those specific concerns, but not a lot of people are able to educate themselves by going to the websites or doing a Google search to understand what is going on, what their body is dealing with at that specific time. So we need to work collectively within our various ecosystems. And when I say ecosystems, I mean healthcare systems, I mean patient advocacy organizations, the federal government, as well as employers, to look at health disparities and how is that affecting people in their day-to-day. You know, when people access the healthcare system, they're coming with their lived experiences as well. And so we want to meet them where they are and be able to have a workforce that looks like the individuals that are serving these various communities. And so that's what I mean about health disparities. One thing I love about CSC is that we're actively working to address health inequities. We're figuring out ways where we can be planted in the community, because that's the only way that the community will gain confidence, is if we go to them. And our project with the Navajo Nation and working in tribal lands to ensure that they have access to care. We know that a lot of tribal lands did not have cancer facilities in their specific area. So bringing that care and working with the officials there to elevate and amplify why it's important, because disparities exist beyond just race. They exist beyond just economic status, and we have to take a holistic approach to addressing it before we can really move the needle. And I think that with CSC's work, along with our government now really taking action in this space, we can really make meaningful steps to increase access and affordable care for everyone.
Thank you. And I'm just going to remind anyone who's watching now live that you can submit questions, and we will do our best to get to every question that has been submitted so far and to those that are being submitted now. And for those of you who may join us late, what we may do is be able to come back and answer your question in the comment fields on Facebook. So please enter your information here, reach out to us. Our telephone helpline, just so you have it, the telephone number is 888-793-9355, and that's posted on our Facebook page as well. So after this, if you have any questions, if you have any concerns, if you have any needs, if you're somebody with cancer and you're not, getting access, or you can't afford your treatments, please give us a call. I wanted to jump into some of the questions. Felicia, one of the questions that, or one of the statements that you made as you were opening was around routine screenings. And we know that, especially with COVID, there was a period of uncertainty, especially in the beginning, where everything just shut down, and rightly so. We didn't know what we were dealing with. We needed to really focus on people who were in that really acute phase, and we pushed resources, to that. But what's happened is that there have been routine screenings that have been delayed, so I know myself, my mammography my mammogram was delayed by about 6 months. Which was fine because I'm fine, but there may be those people who, didn't have that same fortune that I had, to have a normal result. So when we think about, screenings and what could be happening, and that is that either people still haven't gone in for screening and they may have a suspicious lump somewhere that they haven't had examined, or they may have received their screening and now they have a cancer that's more advanced because they weren't able to get in earlier. What are we asking the administration to do, or what do you think they can do to help right side that a little bit, getting people back in, helping people that may be a little bit late to that screening need?
Yes, thank you, Linda. Honestly, what we can do as organizations is encourage people in our various communities to resume recommended cancer screening and resume their preventive and prescribed care. And this includes, that regular cancer screening for, like you mentioned, mammograms and colorectal screening, as well as those for prostate and in addition to cervical. But I would put that in the context of what is recommended by your doctor. So having the conversation with your physician and provider about the importance of these cancer screenings and how early detection is key and screening is also important. So we are working and encouraging the administration to partner with organizations like CSC, partner with other sister cancer organizations in the community to ensure that people feel confident going back into medical facilities to get those recommended cancer screenings. We have to get out there and say, yes, this is still important, even in the context of COVID, and work with our providers, physician oncology providers, to ensure that they create a safe space for cancer patients and for people who want to get the routine screenings to feel comfortable going in. So it's a collective endeavor that we all have to go through, and it's coming from, I would say, from the White House down to the local communities to elevate that. And CSC has partnered with various sister organizations to put out a public letter expressing the importance of resuming recommended cancer screening.
Great, thank you. Elizabeth, we had someone submit a question. So this person has a head and neck cancer. And, oftentimes if you have a head and neck cancer, that's still treated either with radiation therapy or with surgery first. And so there's a small space to work on, there. And sometimes as a part of the reconstruction, they might need dental work, right? Specific dental work. And this person was saying that their concern was that the insurance didn't cover that reconstructive dental work after their surgery for head and neck cancer. I wonder if you could speak to that a little bit.
Absolutely. This is a really critical question for a variety of reasons, and thank you to the person who submitted it. Having worked with head and neck patients, I saw this many times, folks who were in need of dentures or dental work and simply couldn't access it, because when the average person thinks about cancer, they don't think about those needs that you have. So whether it's dental work or durable medical equipment, I have a friend who recently had cancer, and we don't even think about the fact that wigs are so expensive, right? And so when we're thinking about the variety of things that a cancer patient might need, that speaks to the importance of the full cancer patient experience. And that's really what we focus on at CSC. It's not just about the treatment, although the treatment's incredibly important. It's about everything that you go through. It's about how much it costs to park when you go in for treatment. It's about who's going to take care of your kids. And, it's about paying for mental health therapy if you are dealing with some emotional challenges as a result of having cancer or cancer treatment. So this is a really good example of something that's expensive and something that may not be covered by insurance. It's also a great way to advocate with your insurance company, talk to your physician and have them advocate, file an appeal. We have some really good resources on our website for how to file an appeal with your health insurance company, because, dental health is so extraordinarily important. And I think that so many head and neck patients are dealing with this exact same thing, but it just points to the fact that you're a whole person. You need to have whole person care. We need to be advocating at micro, meso, and macro levels to access all of these things. And we're happy to help provide the resources to file those appeals, to talk to Congress, to talk to local decision makers, to make sure that we're helping patients access everything that they need.
Great, thank you. And I think about just listening to you, right? The nurse automatically comes out in me, and you think about how important nutrition is, and you don't think about just, it's not dental work, it's not just appearance, but it is. Patient outcomes are just better if they are able to maintain their nutritional status and the needs around that,
Absolutely.
And I like that you talked about mental health services. And for a long time, we've known that the reimbursement rates for mental health services are not what they should be, and that can affect the affordability, right? The access and affordability for people to go in. And we had a listener just comment about PTSD, and how a diagnosis of cancer is a traumatic event, and, being able to have help in managing the, potential PTSD effects.
Yeah, and I want to comment on that quickly, because I love that the guest or the person on our audience talked about PTSD, because I used to do some work in military and veterans affairs where we talked about PTSD a lot, and we would say it's a normal reaction to an abnormal situation. And I think about that in cancer, right? If you are having emotional challenges or mental health challenges as a result of cancer treatment, worrying about your family, that's totally normal, right? And not that you have to, but so many people do, and it's okay. And so from a policy perspective, we need to fight to ensure that, you brought up reimbursement rates, Linda. That means that mental health providers can be covered by insurance, so that we don't just pay out of pocket for those services. So whether you're talking to a social worker, a psychologist, a psychiatrist, a counselor, we want to make sure that you can do that and do it in an affordable way, bringing us back to access and affordability. Because today, if you have means, you can get mental health therapy, right? You can pay out of pocket, but so many can't because it's expensive. And so making sure that we are fighting to make sure that people understand the mental health challenges inherent in a disease like cancer, and also that people have access to resources to help them deal with those challenges.
Thank you. Felicia, I am wondering if you can talk about the executive order to reopen the special open the special enrollment period, and what that means for people and how they might go about doing that.
Yeah, sure. So last week we saw President Biden issue 2 executive orders that focused on strengthening access to quality, affordable care. And within those executive orders, he created a 3-month special enrollment period that would start February 15th through May 15th. And this is a special enrollment period for through the Affordable Care Act and for the healthcare.gov, which would help individuals purchase health plans on the federal exchange. And so this special enrollment period will allow people who were unable to enroll in health coverage back in 2020 to enroll in coverage for 2021. These are individuals who may have lost their jobs as a result of the economic downturn due to COVID-19, or simply who have been searching for an affordable plan that will help them get the care that they need. This action was very bold on a bold action that President Biden took, and really through advocacy, through the work of organizations like the Cancer Support Community, raising our voice to Congress and raising our voice to the administration, asking for this special enrollment period. It was enacted so that millions of people could obtain coverage to ensure that they would be able to have access to care. And this is, like I said, a state advocacy and federal advocacy. And also one thing that was included within the executive order was strengthening Medicaid, allowing a way for the federal agencies that work with the Medicaid program, so the Department of Health and Human Services, to think about harmful policies that are in Medicaid right now that are creating barriers to care. We can go back to connecting to those disparities and what those barriers do, such as making work requirements for people who have to even qualify for Medicaid. We already know that people who have Medicaid work, but to instill a requirement for them to have to work in order to obtain coverage significantly puts barriers in front of cancer patients who have low income, as well as their loved ones who need to have access to care. So this executive order was a way to really get people back into searching for coverage, obtaining coverage, and ensuring that they have some comfort in knowing that they can go to the doctor, especially during this critical time.
And people are able to enroll by going where? How do they enroll?
They can go to healthcare.gov in order to enroll to the federal exchange.
Great. And if you need help with that, you can call our helpline, and we'll repeat the number again, or pin it to the top of the chat. So Elizabeth, while we're sort of talking about healthcare coverage, we've had a question about COBRA and COBRA premiums. And, the question is about making sure that people, especially as they're transitioning jobs, they may have, to Felicia's point, they may have lost their jobs as a part of the economic downturn and they need to transition into that. But, can you speak broadly about what options are? So if somebody has lost their insurance coverage, COBRA is one of them, it's expensive. What are the options there?
Yeah, it's a great question, especially now in light of the COVID pandemic. We've all seen that we are, unfortunately, because the United States largely ties health insurance coverage to your job, right? We know the ACA changed that to a certain extent, and I'll talk about that. But for the majority of Americans, your health insurance coverage is tied to your employment. And through this pandemic, we've seen so many people lose their jobs. And so you wake up the day after you've lost your job, and what do? Right? It's not that you just don't have income. It's also that you no longer have health insurance. So COBRA is the program that you can opt into to continue your employer health insurance coverage. But Linda, you hit the nail on the head. It is very expensive. It is, for most people, thousands of dollars a month. And that's just not tenable, right? There's not many of us who have thousands of dollars a month to spend on this. And that's just for coverage. That's not everything else that you'd pay for out of pocket. And so what Felicia just talked about in terms of the healthcare exchanges being open are critically important, because you can search for health insurance coverage that's right for you. Under the Affordable Care Act, you can decide what you can afford. If you are under a certain threshold, you could get Medicaid coverage in many states as well. So making sure that you're able to access coverage for folks who live with lower incomes, and also Medicare, right? If you're over the age of 65, exploring your Medicare options as well. So there's lots of different choices. Again, go to cancerinsurancechecklist.org so you can make informed decisions as you're deciding about this. But it's, healthcare is complex for sure. And there's lots of different things to make decisions about as you're deciding how to pay for coverage. But I will say, if you are at risk for cancer, if you have a family history, if you've had cancer, you have to have coverage. You have to, or, having no access just isn't an option. And so our helpline is here to help people answer those questions. The Cancer Insurance Checklist, we have lots of resources to help people make these decisions.
And I will sort of go on a limb here. And I know that we at the cancer support community try to help individuals get to a point where they're making the best decision that they can make for themselves. But there has been one time that I know of, and I've been a part of the organization for a long time, where we have issued a recommendation, and that was around the level of insurance that they should buy if they're shopping the exchanges, if at all possible. And so do you want to just talk about the levels and where we think is sort of that minimum threshold so that they can get at least adequate coverage should they have a diagnosis of cancer?
Sure. Yeah, it's a good question, Linda. And the levels of health insurance coverage that are available in the exchange are metal tiers. So it's silver, gold, platinum. There's also something called catastrophic coverage. And what I would say today is don't get catastrophic coverage, right? It covers very little and you would pay a ton out of pocket. And the metal tiers are balanced based on what you would pay for your premium. So that means what you pay annually to keep coverage or monthly. So think about what you pay out of pocket. Let's say you have employer coverage and you pay $100 out of pocket every month. That's your premium versus your deductible. So that's what you pay out of pocket, out of your own pocket before insurance kicks in. And so the deductible and premium are often balanced. Are you going to pay more premium up front and less out of pocket for your deductible? Or are you going to pay a lower premium up front because you think, I'm not going to really get sick, so I don't need to worry about out of pocket. For people living with cancer or at risk for cancer, it's really important to be prepared that you are going to need a high quality health plan. So it's important to think about those metal tiers, what you're going to pay out of pocket up front versus what you could pay out of pocket down the road. And we have lots of resources that can help people think through that. But I would say steer clear of that sort of catastrophic coverage, because it's just there for people, you know, if you had an emergency and something happened, but you're going to pay a ton out of pocket. But this all just points to the importance of health literacy, of understanding insurance. And that's why we're here to help people understand that. And again, the helpline is a great resource to help people with that.
Great, thank you. And I know that we are running short on time, but there are two issues that I think are really important to discuss. One is around telemedicine and telehealth. And Felicia, I may have you take this one if you don't mind. You can punt it to Elizabeth if you want to. But the concept that, you know, we at the Cancer First community have done a survey recently on COVID, right? And we've talked to 500 and some patients who, you know, have been engaged, cancer patients, and their concerns about COVID, their experience during COVID, you know, that sort of thing. And for you listeners, the results will be released once we've had a chance to go through them all, so stay tuned. But one of the things that we learned is that a high percentage of patients have been able to continue with healthcare visits via telehealth. And it raises the question, and this came in from somebody, that not everyone has access to what they might need to participate in a telehealth visit, right? So they may not have Wi-Fi access, or they may not have the device, you know, to do a Zoom call or another call. So what are we doing, and what are we asking to ensure that we create a level playing field around telehealth, which is not going to go away even after COVID is under control?
Correct, Linda. It's not going to go away. We're advocating for, I'll take it in tiers. We're advocating for permanent flexibilities when it comes to telehealth and telemental services. And so that's allowing for these services post-pandemic to ensure that people are able to access their providers from the safety of their own homes without disruptions to care by reaching out to providers through telehealth and telemental services. And so this would look at making sure that doctors are able to provide telehealth services across state lines. Right now, they're not able to. They have to stay within the realm of the state that they live in and can practice in. But as far as broadband access, we know that that's a barrier to care. It's something that the Federal Communications Commission is looking at. How can we increase broadband access, especially in rural communities, but also in urban communities, looking at areas where there's low income rates and different socioeconomic statuses people who don't have access to this care. And through some of the money that was implemented through the COVID relief packages that Congress passed early last year and on into the end of last year, there are pilot programs that the FCC is implementing to really examine how can we increase broadband access for all to eliminate this digital divide, this digital poverty that exists, so that while others are benefiting, we want to make sure all are benefiting. And the FCC is doing the work, but also HHS is doing the work through these flexibilities that came out with through COVID. And CSC is doing the work by examining the issue. How can we work with HHS and FCC to put them together to ensure that while we're providing the healthcare services, what are we doing for the top tier, which is ensuring that there is some type of broadband access? And that way, again, looking at, that's a disparity in care right there for us to focus on. And I think through the pilot program that the FCC is trying to implement, there will be an increase in access to care for everyone. It's just us making sure that we stay on them and raising our voice.
Thank you. Elizabeth, I'm going to ask you to address, we've had a ton of people listening today talking about lymphedema. And right, to sort of put it into perspective, I would call lymphedema a side effect of care. You know, typically it's a side effect of surgery. If somebody has had a mastectomy, you remove lymph nodes, so the drainage, you know, that would normally be in your arm isn't there. Men also have lymphedema if they've had prostate surgery or if they've had other sort of pelvic surgery where there's the lymph nodes in the groin, you know, that are impacted. They may have swelling in their legs or, you know, lymphedema from that. So what we're hearing is that people are having trouble getting coverage for lymphedema therapy. I'm gonna let you speak to that.
Absolutely. And I, as a social worker who's worked in a healthcare system before, and I know Linda as a nurse, lymphedema is a huge quality of life issue. It's a huge physical issue, but it's a huge quality of life issue. So I'm not surprised to hear that people are frustrated, right? Even if you can get your insurance to cover treatment and the general things that you might need, lymphedema is an excellent example of something that should be covered by insurance, but often that isn't. And I think, when we think about advocacy, we often think about that big P policy, which I'll let Felicia talk about in terms of congressional action, but it's also the smaller P policy in terms of advocating with your insurance company, right? And I know for cancer patients, it's so frustrating because you're sick, you don't feel good, you don't want to be spending your time on the phone with the insurance company, but work with organizations like us to help raise your voice, because it's so critical for insurance companies to hear, this is unacceptable. It is unacceptable for you not to cover the things that I need to live a happy and healthy life. I'm not asking you to go above and beyond, right? I'm asking you to provide the necessity for what I need to have a good quality of life. And so I think lymphedema is an excellent example. Again, it brings back together that full patient experience, that it is not just about you finish your chemo, you ring the bell, you walk out the door and you're good to go. There are so many side effects, as you said, Linda. This is a great example of a physical side effect with quality of life issues, but again, mental health as well. There's so many different side effects that people deserve access to the care and resources and treatment that they need. And so I think this is just a really good example of that.
Great, thank you.
Mhm.
I want to say one thing to our listeners. Then Felicia, I'm going to hand it off to you. I'd like for you to make your ask, and then Elizabeth, I'm going to let you have the final word of the day. How about that? So I just want to thank everyone for joining us today for our little fireside chat. I have my my little fireplace to add to the mood today. And what I hope more than anything that you will walk away with is an understanding of how important your voice is in this policy process. And I'm intentionally avoiding the word political because I think a lot of times we think that it is political, parties, that all of that kind of stuff, but it's really, we're talking about the way in which people live with cancer and the way in which caregivers live with their loved ones' cancers. And so I'm hoping above all today that we've been able to provide you with examples and stories about how this policy piece is so incredibly important to help people live with cancer in the best way in which they can. That's number one. Number two, I hope that we have somehow inspired you to become involved in the process. And we would love to have you either share your voice through research, share your voice through policy, call our helpline if there's anything that we can do to support you. Those are the two things that I just want to wrap up, my part of this and saying, thank you. I hope that we were able to sort of help you think through, why this political, from Washington to your living room is so important. And then, how you might like to get involved. So I'm going to stop there. Felicia, I'm going to turn it over to you. I know that you have a special favor to ask.
Yes, thank you. I really just want to reiterate what both Linda and Elizabeth have said. Cancer is nonpartisan. This is not a political push. We're really looking at big P policy and how you all can work together with us to ensure that we hold Congress and the administration accountable and making sure that they put cancer patients and patients as a whole first. And the way that we can do that through our World Cancer Day action is by asking them to prioritize cancer patients by addressing 4 issue areas in their first 100 days. And so I'll just walk you through these 4 issues really quickly. And you can find the way to sign on to our statement through our main homepage website, and also through some of our blogs and social media page, which currently you're on Facebook right now watching, so you can definitely sign the statement now. So we're asking President Biden, Vice President Harris, and members of Congress to prioritize cancer patients by addressing these 4 issue areas in their first 100 days. We want them to work with Congress the Department of Health and Human Services, and partner organizations to encourage routine cancer screenings and treatments. We're also asking them to work with the Department of Health and Human Services to act against harmful policies that create barriers to timely, high quality, and comprehensive health care. And our third ask is to prioritize addressing disparities in healthcare to ensure equitable access to quality, affordable care for all people. And lastly, we're asking the administration to work with Congress to address affordability and stability in the overall healthcare system in order to protect patients and ensure that they're able to afford all the coverage that they rightfully deserve. And so, Linda, that's our specific ask, and it's 4 issues that we at a local level can interact in and make sure that Congress is and the administration is listening to the collective cancer community voice.
Great. Thank you, Felicia. This is exciting. And I just want to close out. I'm going to tie a few things together here, but first to thank the audience for joining us today, to wish everyone a happy World Cancer Day. It's so important to have the attention to this disease that has been have such an impact on so many people's lives over the years. And I want to end with an idea, because one of the things that I hear a lot from people is, it must be scary to be an advocate, right? Like, I'm not going to go up to Congress. I'm not going to advocate. And I want to tie together both sort of World Cancer Day, and one of my heroes is a man named Whitney Young. I don't know if Felicia is familiar with Whitney Young. He's a social worker, like we are. He's also from my home state of Kentucky, and he is a Black American. So thinking about Black History Month right now. So Whitney Young was president of the National Association of Social Workers. And he said to social workers, don't forget that you know more about the social problems of this country than anybody else. So when you think about talking to members of Congress, you know more. And I want to put that in the context of cancer. For people impacted by cancer, I guarantee you know more about what it's like to live with cancer and about the healthcare system than people who've never been through that journey. And that includes many decision makers, policymakers. So I think it's our responsibility to lift our voice and share what we know to improve policies and decision making. So everybody go look up Whitney Young. He's amazing. And I thought that was a great way to cap off our Facebook Live today. So thank you, Linda. Thank you, Felicia. And thank you to everyone out there for your time today.